A new study shows that brain fog, fatigue, and neuropsychological effects are most prevalent among people with long COVID. Well, let's discuss this now to understand it and unpack it further with Giulia Criscuolo. She's a pharmacist, complementary medicines expert, joining us now live from Swellendam down there in the Western Cape, one of the most beautiful parts of this beautiful land of ours. Giulia, good afternoon. Thank you very much for your time. Thanks for joining us here on today. Just clarify for me first, what is brain fog?
Basically, Dan, brain fog is when your brain is not working properly, okay? So essentially, you might feel that your memory is poor, your cognitive decline, so you can't think properly. You battle to concentrate and to focus your mind. You might also have some anxiety with brain fog, and your brain just feels not clear. You also feel fatigue with brain fog. So these are some of the symptoms that one could find in this condition.
So this is one of the conditions that a new study has found, that's brain fog, fatigue, and these neuropsychological effects that are being prevalent now among people with persistent symptoms of COVID-19. I mean, how widespread is this? Some studies done globally in the US and the UK show that there's millions of people, at least in the UK, I understand. I saw some reports about 2 million people currently living with long COVID.
Yes. So for those who are not clear, long COVID is really where the symptoms, after getting sick with COVID, they just persevere and persevere. Even after a year, after recovery, you still are having some symptoms, whether it's neurological, respiratory, digestive. And yes, they've said that, like you said, Dan, 2 million people have long COVID in the UK, and between 5 and 50% of people who got COVID tend to experience this long COVID where symptoms just go on, and they just don't feel 100% well again, like they used to before they got sick with COVID.
Yeah, so I guess there might be people who will just carry on like that, including here in our country, many of them going undiagnosed, due to them not seeking care or maybe due to misdiagnosis.
Yes, and I would say, if you experience things like brain fog, where you're really battling to focus, your mind isn't clear, maybe also you just have constant fatigue, you might have headaches, anxiety. They also found in the study numbness, tinnitus, tingling, blurred vision. These are some of the other symptoms that came up in the study that was done in the USA. So I would say that if you can't find any other reasons for these kind of symptoms, then go have it checked out and find out what's actually going on. You don't just have to live with this. There is something that you can actually do.
And what would that look like? Would you then go and get diagnosed maybe correctly and treatment is possible?
Well, Dan, it depends what your symptoms are. So if we look at, for example, the neuropsychological symptoms, where you are experiencing anxiety, your cognition isn't what it used to be, your memory's failing, you just don't feel clear in your mind. The important thing is to see what you can do by yourself. So, for example, look at your nutritional status. What food are you eating? Is it rich in important brain nutrients like iron, vitamin B12, vitamin D3, and also omega-3 fatty acids? These are all very, very important brain nutrients. It's been shown time and again that if you are lacking any of those, it's going to affect your nervous system. It's even been shown in children, for example, who have iron deficiency anemia, their cognitive abilities are definitely compromised. So make sure that nutrition-wise, you are looking after yourself. And then importantly, is to make sure that you're getting enough good sleep, exercising, getting outdoors. And are you actually being socially stimulated? Are you having social connections? That's also very important in terms of our well-being. So it's not just one thing, it's actually multi-dimensional. And if you are struggling with any of these things, then you're eating good food, sometimes supplementation can be very, very helpful.
Yeah. So brain fog, just to go back to that aspect of what has been found in this research, is not only due to long COVID, I mean, health-wise, because you've mentioned earlier that, like now, if you don't eat well, and maybe if you have hormonal imbalances and stuff, you could also suffer from brain fog, and you need to get the help as well.
Yes, absolutely. Many other viral conditions, post-infection, can lead to brain fog. Also, if you've had concussion recently, if you've had any kind of chronic fatigue syndrome or any kind of brain injury, post-traumatic brain injury, these are some of the conditions can also lead to brain fog. So it isn't just related to COVID alone.
Yeah, I'm just wondering, as you're answering, then I've been talking to you now for the last few minutes, what else is it that we don't actually know about long COVID, that people are walking about, and we don't understand the full impact? I think it's going to take quite some time for us. But the message, I guess, is if you are having something that you never used to have and are not sure why, like fatigue and lack of sleep and stuff, do something about it.
Yes, absolutely. And if you are experiencing, for example, the fatigue that you said, make sure that you aren't iron deficient. Make sure that you are eating properly, because sometimes it's something very simple that one can do in order to restore their balance. There are amazing supplements out there like Spartone, vitamin D3, and also omegas that can really help to take care of your nervous system, your brain function. And we think, what is B12, what is iron? They seem so, relatively insignificant. But when your body lacks those nutrients, then the consequences are quite drastic, and it can express as brain fog and fatigue. So Spartone, vitamin D, omega-3s, those are kind of supplements that I think we need to look at if we're experiencing these symptoms. But yes, for sure, you can do something about it, but don't just carry on and on feeling terrible. Take control, take charge, and find out what's going on and what you can do about it. And lifestyle, as I've said, is very, very important.
Thank you very much for your time and insights this hour here today on eNCA. That's Giulia Criscuolo, pharmacist, complementary medicines expert, talking to us live virtually from Swellendam, there in the southern parts of the Western Cape.